This segment of DelmarvaLife is sponsored by TidalHealth Home Care.
There is a shortage of nurses in our country, and even fewer are seeking to join the nursing career, but that does not diminish the need of our community for skilled wound care. And to respond to the community need, TidalHealth Home Care has supported 3 of their registered nurses to obtain their certification as wound care nurse specialists. And here today with me in Historic Studio D is Christopher McLean. He is a wound care certified RN, along with Robin Kokenauer, VP of Clinical Operations for TidalHealth Home Care. Thank you both for being here.
Thank you for having us
this afternoon. Chris, I want to start with you. How common is it for a person to have skin issues or need skill?
It's actually more common than what you think. Roughly 2.5% of our population in the U.S. has what I consider as a chronic wound. That's roughly 8 million people. With chronic wounds, that doesn't include your scrapes or your lacerations or your surgical wounds. So here locally, we see more chronic wounds than we do what we consider an acute wound, but they are definitely way more prevalent than what you think.
Obviously, acute wounds can turn into chronic wounds.
Acute wounds can, especially if there's an underlying diagnosis that we don't know about yet.
Right. So how does being a wound care certified nurse differ from being, I guess, an RN?
Traditional RNs will typically take an order provided by a provider and then perform that order to help heal that wound. Wound care certified nurses really take a deeper dive into that wound. We look at stages of healing, where they are at in the healing process, even though they will progress through staging. Chronic wounds will sometimes get to stage 3, then get back to stage 2. So we really take a deeper dive into that. We look at nutrition, we look at comorbidities. So that is what really a wound care certified nurse will do. And we'll actually make recommendations back to providers.
Yeah. So Robin, with skilled home care services at TidalHealth Home Care, is there a difference between having wound care at a center or in a facility?
There is. We have the population that we serve are mainly people that it's super taxing for them to leave their home. Very difficult. They usually have to have the assistance of another person, a walker, they've got their portable oxygen tank. It's very difficult for them to get out. So to be able to have wound care done in their home, it is so much easier on them overall. And when you're in your home environment, you feel better, you feel safer, you eat better, you sleep better, and all those things help with wound healing.
And I mean, that really goes for anything that you're dealing with, doesn't it? And that's why TidalHealth Home Care really is important for people who can't make it to a facility?
Yes, absolutely, 100%. And even if you aren't able to, if you notice something or your caregiver notices a new area somewhere on your skin, you can even just have your doctor just call us. You don't even have to go into the doctor's office or to a wound care center. We're happy to send one of our wound care specialists out. Like Christopher, he could go out and actually make an assessment and call the doctor's office. So it's a really nice way to do it.
So Chris, when is the best time to receive a referral for wound care?
Receiving the referral, we would like to get it earlier than later. If you have a wound and you talk to your provider and they send us out, that's probably the best time to get it. The longer you wait with anything, the worse it typically gets. So the longer you wait, you get infections, you can get the area getting bigger, the wounds getting deeper. So sooner the better is what we would like to see, because the sooner we can get in, the faster we can heal it and get you back to what normal life looks like for you.
And am I right in assuming it's not just the wound care, but it's education for the people, like the caregivers that might, and even the individual patients?
Yes, 100%. We always involve the caregiver in the wound care process. If something malfunctions or a dressing, might need to be changed impromptu for some reason of complication, then we've trained those caregivers on exactly what to do. And of course, they can always give us a call in addition to that. But the other parts of the education are certainly, like I said, things that promote healing. A good diet, lots of rest, exercise, if it's a wound on your extremities, keeping them elevated. So we're constantly, always teaching.
Yeah, it's a multifaceted process. Chris and Robin, thank you so much for coming in from TidalHealth Home Care.
Thank you.
Enjoy the rest of your day.
Thanks.